Dr. Roach, can you tell me a little bit about yourself?
I've been a child neurologist for 30 years. I'm professor of pediatrics and neurology at the Ohio State University College of Medicine in Columbus, Ohio, and chief of neurology at Nationwide Children's Hospital. And I might add that as the current president of the Child Neurology Society, this is an important issue because this is a difficult form of epilepsy.
You are with the LGS Foundation, correct?
Yes, I'm the president of the LGS Foundation. I founded the organization in 2008, and I'm also here to have the discussion about transitions. My brother is 25 years old, so I've been down that road. He has Lennox Gastaut. He was diagnosed at age 3, and he's an adult now.
And your son, Sam DeMarcus, correct?
Yes.
He was diagnosed at 3 with LGS.
As a parent, I'm here today to try to find out more about the moving from child adolescence into adulthood.
So Sam, can you tell us a little bit about DeMarcus's experience with LGS?
So after being checked out in and out of hospital, a specialist neurologist, child neurologist, told us that he has partial complex seizures.
How does he spend most of his days? Does he go to school?
Yes, he does. Goes to school. He's in a special program, interacting with different kids, same type disabilities that he may have. Some of them are more verbal, some of them aren't, but he's migrated into that small special class. He does pretty well. He's making great advancements and every single day. He's just doing good in the class.
Can you give us a little bit about DeMarcus's activities?
He's like a little boy, his age. Likes to do age-appropriate things, riding his bike, playing at the park. Riding the bike is a challenge because I have to run behind him all the time.
So you're keeping in shape then?
Yes.
That's good.
Stay in shape in that manner. A lot of the things that he enjoys to do is puzzling, working with puzzles. He can use a computer. Use it a lot better before the seizures came on. But what we've done is work with him through therapy. And puzzles is one thing he really likes to do. And one thing that has helped him along with the puzzles is using something that I helped him with is clothespins. I was able to take clothespins and help him through therapy because he couldn't use his fingers a lot after the seizure disorder came on. Now he's able to pinch the clothespin. There's even puts them on my jacket or whatever I may have on, and he enjoys doing that. He thinks that's fun. Really enjoys interacting on things where he has to use his balance, and he likes to stand on things like that and just kind of feel like he's accomplishing something.
It can be difficult for a parent to determine when the right time is for a child to move from pediatric to adult care. In your opinion, I mean, besides age, are there some other factors that can determine when a patient is ready for that transition process?
It's a complicated process. Parents in some situations have more options than others, and that may be geography, it may be related to the diagnosis. And honestly, if you have a good pediatric care team and you start looking to transition, sometimes you just can't find the same specialists who know about the disease and who are comfortable with children with those kind of illnesses.
Christina, do you think there's a right time to make the switch?
Well, transitioning isn't an event, it's a process. And it's important to start early thinking about the transition and thinking about switching doctors in the future.
So as a person with LGS moves from childhood to adolescence to adulthood, frequency of seizures may change, seizure types may change.
The seizure types change relatively often. You'll have a child who has a predominance of one seizure type, and then they hit adolescence and they will do something very different. And of course, the other thing that is layered on top of this is our constant efforts to control the seizures with medicine or diet or whatever. And so it's very common actually to have a completely different profile when you get to adolescence or adulthood than when you're a child. And the other thing that often occurs in this is these individuals are maturing, so you start to see sometimes behavior changes and things of that sort, not just the seizures. And if you have a behavior change and you're talking about a large 15, 16-year-old adolescent, if the behavior is not good, then it becomes more difficult for just the behavior, not just the seizures.
Dr. Roach, can we talk a little bit about the family dynamic? How does LGS affect the entire family unit?
This is an area that's often overlooked, I find. Everyone concentrates on the patient appropriately enough. Sometimes I've seen siblings basically, well, not exactly ignored, but at least not get their fair share of attention. Plus, the stress level from the parents can be extraordinary. It puts stress on the marriage, the couple.
You feel it's beneficial for the parents to take a little bit of a respite care break?
I do.
Yeah.
Partly it's a matter of pacing. If you'll see parents who throw themselves into the child's care, when the diagnosis is made at age 2, and by age 5, there's nothing left. And unfortunately, there's a lot of illness left. And I couch it to the parents in these terms, that your child is going to need you long term. So pace yourself, take breaks, make sure that you do things together as a couple so that you remain a couple. I mean, I actually have that discussion with them.